Howdy, Josh here from pharmacisttips.com. I'm a registered pharmacist, and today we're going to talk a little bit about the dosage of lisinopril and some of the side effects that can happen with this medication. First off, what is lisinopril? Well, it's a blood pressure medication. It's used to lower blood pressure. Specifically, it's from a family of medications known as ACE inhibitors. ACE inhibitors, they basically work in the kidney, and the effect they have ultimately results in the blood vessels dilating. That helps lower the blood pressure. In the US, it's sold under the brand name Zesteril and Prinavil. It is available in tablet form. Comes in 2.5 milligram, 5 milligram, 10 milligram, 20 milligram, and 40 milligram tablets. Adult dosage. For high blood pressure, it's usually started at 5 milligrams if you're already on a diuretic or if you're using it with a diuretic. A diuretic is simply a water pill. It helps get extra fluid out of the body. If they're starting it all by itself, it's oftentimes started at 10 or even sometimes 20 milligrams, depending on your blood pressure. The max dose is usually considered to be about 40 milligrams once a day. For heart failure, when lisinopril is used for heart failure, often started off a little bit lower at 2.5 milligrams a day, and then increased slowly, usually no more than 5 to 10 milligrams a week, and a maximum dose of 40 milligrams per day. After a heart attack, it's been shown to improve the outcome after a heart attack if it started right away. It's 5 milligrams generally given the first 2 days after a heart attack, and typically then 10 milligrams a day for 6 weeks after that. Of course, that's all up to your doctor, but those are just kind of standard doses. We also see lisinopril used to protect kidney function in diabetics. The dose again up to the doctor, and not all diabetics. There's just certain diabetics they found that that's useful for, and your doctor will help determine that. Sometimes we see the dose lowered if you have poor kidney function. Uh, how do you take lisinopril? It's pretty easy. It's usually once a day, with or without food. Best kind of at the same time each day. That way you get that constant level in the body. And you want to avoid salt substitutes. We'll get into this in the side effects in a moment, but especially the potassium-containing salt substitutes, like no salt. So side effects, most common, hypotension. Obviously, it lowers blood pressure. Sometimes it can shoot too low and make you feel a little faint or dizzy. Usually that's going to happen on the first dose or two. Less than 10% side effects, again, that fainting, drop in blood pressure when standing, which you may see listed as orthostatic hypotension. That just means when you stand up, you get dizzy. Skin rash, rare. Hair loss, less than 1%. People taking lisinopril report hair loss, so that's hard to know if that's the medication or father time. Excessive sweating, again, fairly low in occurrence. It can increase sensitivity to sunlight, not super common. Hyperkalemia, that's simply a big word for increase in potassium. Like any medication, you can see diarrhea, constipation, and gas listed as side effects. Cough. Now, this one can happen, and we do see it happen in 3 to 4% of people who take this medication. Many people describe it as just kind of a constant tickle in the back of the throat. Once the medicine is stopped, it generally resolves in 1 to 4 weeks. Now, I'd encourage you not to stop this on your own, to talk to your doctor to find an alternative, because we still want to control your blood pressure. Of course, more side effects are possible, but they occur very rarely, so I haven't listed all of them here. Okay, serious side effects of lisinopril can include angioedema, extremely rare but potentially dangerous. It's extreme swelling in the head and neck, and sometimes it makes it even difficult to breathe. So if something like this were to occur, of course, you'd want to get yourself to the hospital. And if it does happen, it often happens with the first dose. It can make breathing difficult. So low blood pressure. Now, this oftentimes happens simply because people get dehydrated, and which can drop your blood pressure, and then the medication on top of that lowers your blood pressure even further. If it continues to be an issue, the dose may need to be adjusted. That's something you'll want to talk to your doctor about. And then back to the hyperkalemia, that's, remember, high potassium. If your kidneys aren't functioning well, this can increase the risk of that. This is why your doctor will want to monitor your labs every so often, and that's why we want to avoid potassium-containing supplements. So just keep that in mind. All right. Well, thank you for watching the video. I'm going to have a summary of this information at pharmacisttips.com/lisinopril. Always be sure to talk to your doctor or pharmacist if you're uncertain about your medication, if you feel you're having side effects, if you think you might be having an interaction. Just keep those lines of communication open. The sooner we identify some of those things, the less likely that you'll have bad things happen. And if you have further questions for me, you'd like me to explain medication, please stop by pharmacisttips.com/ask. Thank you.